Welcome back. Today we are featuring one of our expert sessions from the recent 5th Annual Virtual Sjögren Summit, where leading clinicians, researchers, and patient advocates all come together to share the latest science and practical strategies for living well with Sjögren's, dysautonomia, and related immune-mediated conditions. In this session, Jennifer Henning, Nurse Jen, explores one of the most important and empowering aspects of Sjögren's care, reducing the everyday inflammatory burden. You'll learn about environmental exposures, air quality, nutrition, sleep, stress, movement, vitamin D, and other evidence-informed lifestyle strategies that can help support a healthier immune system. If you find this presentation helpful, please subscribe to our channel so you don't miss future educational content. And if you'd like to access even more expert sessions just like this one, along with bonus resources from the Virtual Sjögren Summit, check out the link in our description below for information on how to access the complete Summit library. Thanks for watching and enjoy this special episode.
Hello, welcome everyone. My name is Jennifer Henning, and I am your Immune Confident Institute nurse practitioner, and I'm so glad that you're here and able to join me today. I want to start by acknowledging, you're living with Sjögren's, autoimmune disorders, and that's really, really hard work. So I'm so glad that you are here and that you showed up, and I'm so excited to talk to you today. Today, we are going to be talking about connecting the dots, the link between your autoimmune disease, your environment, and inflammation. Sjögren's disease and inflammation go hand in hand. Sjögren's is a condition where your body's immune system gets confused. It attacks healthy parts of your body. Your body is really working in overtime, and that can result in things like dry eyes, dry mouth, tiredness, and joint pain. Right now, your body is getting its signals mixed up. And because of this, Sjögren's can cause a lot of uncomfortable things. Inflammation is your body's way of fighting germs and healing injuries. Right now, your body is stuck in that on position, and different triggers in your world can increase the inflammation associated with Sjögren's and other autoimmune conditions. Some of these different triggers are viruses, chemicals, the air around you, helpful and harmful bacteria in your gut, and stress. We know that Sjögren's disease happens because of a mix of your genes and the world around you. It is a combination of different things over a long period of time, not just one single factor. While we can't change our genes, we can control the environment around us and do things that puts the power back in our hands to decrease our exposures and protect our health. When we think about the different environmental exposures and the research that's been done, viral infections have had a lot of studies done that show that they cause the inflammation to increase in our body. Those different infections are that have been studied are the Epstein-Barr virus, cytomegalovirus, hepatitis C. There's so much emerging research on COVID-19 and mumps. Things that we can do to help decrease our exposures to viral infections are things like good hand hygiene, washing our hands with soap and water, respiratory etiquette. So this is going to be like covering our mouth when we cough, using a tissue to cough into, washing our hands after coughing or blowing our nose, masking in high-risk areas, things where we're going to be around a lot of people, or during the winter time when we know that viruses are at their peak. Discussing different recommended vaccinations with your healthcare providers, and cleaning those surfaces around us, things like doorknobs or frequently touched surfaces. Another thing are the things that are around your house. There are certain chemicals that can bother our bodies, and these are called endocrine disrupting chemicals. It just means that those are chemicals that mess with our body's natural messengers. These are things like phthalates, parabens, and triclosans, organophosphate flame retardants, volatile organic compounds, which cause pro-inflammatory pathways, and organic sulfates. This list of chemicals can sound really scary, but there are ways that we can decrease our exposure to those things around us. It's good to improve ventilation during and after cleaning. Some people may choose to open a window or turn on a fan just to keep that air circulating. Using cleaning products that are fragrance-free and solvent-free. You can use glass or stainless steel food containers instead of plastic containers. Wet dusting is a way to keep the dust and debris from flying around in your home. And vacuuming with a HEPA filtration system helps to reduce the dust-borne particles in the air. You can also get HEPA filters that you can put in various rooms throughout your home. I also recommend checking labels for phthalates, parabens, and flame retardants prior to use. Air pollutants are something else that can be triggers. Carbon monoxide is one of the triggers that we see that is linked to inflammation associated with Sjögren's. And it actually is linked to elevation and hospitalizations related to Sjögren's. Carbon monoxide comes from your vehicle exhaust, combustion, and even gas stoves. Nitric oxide is released through traffic emissions and industrial combustion. It's associated with an increase in outpatient visits associated with Sjögren's. Methane is an air pollutant that comes from fossil fuels, agriculture, and landfills. And wildfire smoke is a really big one that can cause inflammation throughout the entire body. And not only does it affect the inflammation associated with Sjögren's, but it can also affect your breathing and your lungs, even in healthy individuals. It's been strongly associated with immune dysregulation and interstitial lung disease. There are some things that you can do to help with the exposure to air pollutants. Things like the HEPA filtration systems on your, in your home. Using HVAC filters that have a MERV 13 through 16 rating. These are helping to clean the air that comes into your home through your air conditioning units. Limiting your outdoor activities when the pollution is high or you know that there's wildfire smoke events. Even with wildfire smoke events, it does not have to be near you because of the jet streams. It can travel hundreds of miles. So it's really important just to be aware of what's going around, not only near you, but even several miles away. Monitoring your local air quality index can also help to know when the air quality is at its best or at its worst. There are several different apps that you can use that help to monitor the local air quality around you. Cold season exposures have also been linked to increased air pollutants. So the colder the air, the more likely it is to have a higher air pollutant. And so it's just really important to be aware of the air quality during all times of the year. Let's talk about your general health. There are several ways that you can improve your general health to help decrease inflammation in your body. Gut health is going to be really important because with Sjögren's, it's been shown that there is less of the good bacteria in our GI tract and more of the bad bacteria, which can make inflammation worse. Stress, even good stress, can increase inflammation and cause the immune system to go into overtime. Sleep is so important, just to make sure that your body's getting the productive rest that your body needs to heal. So if you are having trouble falling asleep, waking up in the middle of sleep, that can all affect the inflammation in your body. Diet is also a really important part to fuel our bodies and helps them to behave in the way that we would want them to. And physical activity is going to be really important just to help improve fatigue, pain, and overall quality of life. Some things that you can do to help improve just general health with exercise, resistance training is going to be helpful to improve your fatigue, pain, and quality of life. And you don't have to start off running a marathon. Doing small, simple changes, one at a time, seated exercises, stretches. Start where you are at and gradually move up as you tolerate things. Diet is going to be also important to fuel your body. Diets that have been shown to decrease inflammation are the Mediterranean diet, which is a lot of more olive oil, legumes, whole grains, fruits, vegetables. High fiber diets, such as legumes, whole grains, fruits, vegetables, can also help to repair that intestinal barrier and decrease the inflammatory pathways. And it's important to avoid high-fat foods, processed foods, refined sugars, and saturated fats, which can lead to further inflammation in our bodies. Our minds are a really important part of how we can manage our stress. And stress management is not only important for our physical body, but for our mind as well. Practicing mindfulness means that you're just present in the moment and breathing. It doesn't have to be anything formal, just kind of sitting in a quiet space, taking big, deep breaths. Some people have found that cognitive behavioral therapy is also helpful with a professional to control stress. And it's important to get routine screenings for depression and anxiety with your healthcare provider. You should never feel ashamed asking for help for your mental health. Sleep is really important for our bodies to do their best healing. And you should never feel ashamed for giving your body the rest that it needs and deserves. If you have trouble sleeping, there are therapies like cognitive behavioral therapy that can help, especially for insomnia. Maintaining a consistent sleep and wake schedule can help to decrease inflammation and helps to improve your general health. The goal is to aim for 7 to 9 hours of sleep. Avoiding caffeine, alcohol, or heavy meals later in the day can help make falling asleep and staying asleep a little bit easier. Putting the phones away to minimize screen and light exposure before bed can help so your mind knows when it's ready to turn off and get the rest that it deserves. It is also important to discuss vitamin testing with your healthcare provider and replace your vitamins based on your lab results. Many people with Sjögren's actually have a vitamin D deficiency, and if we're able to replace those vitamins, then it helps your body to become more balanced and feel better. All of these small changes add up, and you don't have to be perfect. Doing one thing at a time and small steps can help to improve your general health and decrease inflammation over time. Here are some helpful resources and evidence-based articles on the inflammation and what you can do to help improve your quality of life and your health. You're doing a wonderful job navigating your tough illness. Thank you for being here with me today and taking such good care of yourselves. Hopefully, this will be a good reminder to slow down, take things one thing at a time, because those small changes will add up. You don't have to be perfect, and it's important just to do what you can in the moment and work towards bigger goals as you reach those smaller goals. Thank you for being here. Thank you for listening, and have a wonderful day.